Welcome everyone to our ABMS Visiting Scholars Program, our introductory of the program overview and the application process for the 2025-2026 cohort of the Visiting Scholars. I'm Greg Ogrins. I'm a general internist by background. I'm currently the Senior Vice President for Certification, Standards, and Programs at the American Board of Medical Specialties. And along with Susie Flynn, the co-director of the program. Next slide, please. This is what our agenda is for the evening. We're going to start with an overview of the current scholar project. So it's perhaps a little bit of an unusual way to start rather than telling you about the program. But we have found that we really like to start with telling you what the current scholars are doing as a good way to show you the depth and the range of what our scholars do and the types of projects that they work on. We'll then move into telling a little bit more about ABMS as an organization and the program overview. We'll talk about the research priorities for the board certification community, particularly for the ABMS Research and Education Foundation and the sponsoring member boards. Go through eligibility and the application timeline. And this should take us till about 25 or 30 minutes after the hour. And then we'll have time for question and answers, either for me or Susie, or for our ABMS visiting scholars. We think we'll have 2 or 3 of our scholars joining this evening. And we will have them say a couple of words about their experience in the program this year. So that's where we're headed. Let's go to the next slide. I want to tell you about some of the work that the current scholars are doing. So Nick Burns is a obstetrician gynecologist at UT Southwestern. His work is sponsored by the American Board of Obstetrics and Gynecology, and he's looking at the relationship of certification by ABOG with early career patient outcomes in obstetrics and gynecology. This is a good example of a project that is clearly centered on the relationship and looking at that association between board certification and patient outcomes in a specialty. Rima Carr is at Rutgers and RWJ Medical School. She is working on the development of confidence in surgery and can confidence be taught and learned. It's a good example of a project that's working upstream and thinking about the work in residency and even in medical school about confidence in surgery. Next slide, please. Dan London is at University of Missouri and is sponsored by the American Board of Orthopedic Surgery, thinking about standardizing orthopedic competency evaluation, determining inter and intra-rater agreement and reliability of orthopedic surgery evaluators. Vinod Nambudiri is at Brigham and Women's Hospital at Harvard, sponsored by the American Board of Dermatology. And Vinod is a internist and a dermatologist, so he's looking at quantitative outcomes of specialized joint training and research training tracks in dermatology. Again, working upstream in the dermatology residency track. Next slide, please. Julius Oates is at Children's Hospital of Philadelphia. He is sponsored by the American Board of Ophthalmology and looking at step 1 pass-fail era, or step 2 scores in socio-demographic characteristics related to OCAP and board certification examination performance. Grant Schaefer is at Children's Hospital of Orange County and UC Irvine, sponsored by the Gordon Betty Moore Foundation, is working on determining the frequency of diagnostic errors in the neonatal intensive care unit surrounding transport using Safer DX NICU instrument. Next slide, please. Josh Sheik at Cincinnati Children's Hospital, supported by the ABMS Research Education Foundation, looking at representation of Indigenous peoples in the pediatrics and pediatric subspecialty workforce. Haley Silveri is a urologist at LSU, sponsored by the American Board of Urology, the development, validation, impact of robot-assisted laparoscopic pyeloplasty skills assessment rubric. Next slide, please. Allison Wallingford at University of Washington in Seattle, sponsored by the American Board of Physical Medicine Rehabilitation, is looking at the use of biased language in the medical record to describe patients after traumatic brain injury. And Abby Winkle at NYU Grossman School of Medicine, who's also sponsored by the Gordon Betty Moore Foundation, is looking at decision making on the labor floor, assessment of obstetrician, gynecologist expertise among uncertainty. Next slide, please. And David Yang is a emergency medicine physician at Yale. He is sponsored by the J. David Berry Visiting Scholar of the American Board of Emergency Medicine, looking at anti-Asian racial discrimination burnout in Asian American emergency resident physicians. So going through all of the projects, and you get a sense of the different specialties that are supported. There are many different specialties. You get a sense of the different range and scope of the project, some working upstream in residency or even with medical students, some looking at the connection between the board certification process and outcomes, or board scores and other standardized scoring. So this is something that's important to keep in mind about the program, is the tremendous priority that we put on the diversity and the type of projects that come forward, and maintaining that diversity of projects and across all the specialties. Next slide, please. All right, so now you have a taste for sort of what the current scholars are doing. Oh, who are we and what do we do? So the American Board of Medical Specialties mission is to serve the public and the medical profession, and those two stakeholders are really important. And we do that through improving the quality of healthcare by setting professional standards for lifelong certification in partnership with the member boards. So when you look at the structure of ABMS and the member boards, ABMS doesn't actually certify anyone. It is the member boards that do that. So I mentioned I'm an internist. I'm certified by the American Board of Internal Medicine, or the American Board of, and then there's 23 other boards that are part of the American Board of Medical Specialties, and together make up this consortium that oversees certification, both initial and continuing certification. On the right-hand side of the slide, you see that there are close to 1 million board-certified diplomates in the U.S. Just about 800,000 of those diplomates are participating in continuing certification, and the member board certify in 38 different specialties and 89 subspecialties. Next slide, please. So what is the program? The program was established in 2014 to encourage and support research related to board certification. It really is about research leadership, or even QI program for early career physicians, medical specialists, and research professionals. So although we often refer to physicians or residents or early faculty who are participating in the program, of the 76 individuals that have been part of the program over the past 11 years, there are 19 specialties represented, and we've had 5 PhD research professionals also participate in the program. And when I get to eligibility criteria coming up, you'll see that this is not an opportunity that's limited to physicians alone. Next slide, please. The 2025-2026 program begins in September of 2025. It is a one-year part-time commitment. So although it is called a Visiting Scholars Program, as a participant, they remain at their home institution and work with self-selected mentors. The curriculum is focused on a monthly virtual sessions. They're really about presenting research and projects in progress to peers and mentors and subject matter experts. Participate in ABMS committee meetings to get a sense for the administrative work that ABMS and the member boards do. And we do encourage you to present your research and your project findings and outcomes at the ABMS Conference in September of 2026. For this, you receive a $15,000 financial award. So in many ways, this is a small grant program, which is a great way to give a jump start to a project that you're just starting, or to supplement the funding or to do a sub-project on a larger project that you may be engaged in. Next slide, please. So who supports the scholars? As I went through the different projects at the beginning, you said, oh, this person is supported by this board or by this board. And in truth, we do have 24 member boards, and many of those member boards support scholars. So at the very top here, you see the ABMS Research and Education Foundation. The Research and Education Foundation supports 2 scholars, and then we have capacity for 2 more scholars that are supported by the Gordon and Betty Moore Foundation. So 4 total are funded through the REF. The Gordon and Betty Moore Foundation scholars have a particular focus on diagnostic excellence, and I'll mention that a little bit more about that in the next couple of slides. And then you see the list of other boards here, the boards here who are supporting scholars, everything from allergy, immunology, dermatology, internal medicine, orthopedic surgery, radiology, and urology. And several of these boards support more than one scholar each year. So if you see your specialty here, that is an important way to say, well, I want to work within my specialty. I want to work with my certifying board to put a proposal forward and to make sure that your proposal and your work has the best chance of success. Next slide, please. So this is really about research and professional opportunities for the individuals. And so what are some of the things that the scholars do? Well, you conduct scholarly research relevant to the research priorities of the certification community. There are core research priorities that I will review in the upcoming slides. And then each of those board specialties have their own research priorities. So if you're going to be submitting and applying with one of those boards, it is important that you look at those research priorities as well. You consult with your mentors and research data science subject matter experts. You learn from national thought leaders in medical education, assessment, professionalism, certification, and health policy. It's an opportunity to build a professional network of colleagues across the certification community. So we have been working at building an alumni community and keeping the alums together and keeping them connected. You participate in ABMS committee meetings, initiatives, symposiums, opportunities to be involved and to learn about what the boards do and what ABMS does and how you can continue your career working with them. And as mentioned earlier, a chance to present your research findings at the ABMS Conference in September of 2026. Next slide, please. These are the research priorities, and these 5 we think of as the core research priorities. As I mentioned, many of those member boards that support scholars have additional research priorities, but these are the 5 that are overarching all of the applications and all of the funders. Diagnostic and prognostic excellence through initial or continuing certification can be within a specialty or cross specialties. That first bullet point is really a nod to the funding that we have from the Gordon and Betty Moore Foundation to support those 2 positions. Adoption of competency-based medical education, innovative assessments for initial or continuing certification programs. I will mention here that there is a particular interest in developing and looking at competency-based medical education for continuing certification programs. Healthcare equity and diversity across the continuum of physician professional development. You saw that reflected in several of the current scholars' work. Trainee and diplomate engagement in quality and safety activities, especially if related to improving physician well-being. The requirement for improving health and healthcare as part of residency training, fellowship training, as well as part of continuing certification. That 4th bullet is a emphasis on that work and how that may be emphasized and developed in your specialty. And then an intersection between a physician's work, technology, and certification. And technology there, for example, can be electronic health records, artificial intelligence. This 5th bullet point is new this year. It's an opportunity to really try to draw in some opportunities and applications around this connection between technology and certification. There are lots of opportunities to think about how certification may be different, extracting data from electronic health record, or how artificial intelligence will impact and augment the work of certification in the boards. Next slide, please. Eligibility. Okay, so really for early career physicians, medical and surgical specialists, research professionals, junior faculty, fellows, and residents, as well as individuals holding master's or doctorate degrees in public health, health services research, educational evaluation and statistics, public health policy, administration, or other relevant disciplines. That first paragraph is long. It intends to give you a sense that we want to hear and we want applications from a wide range of individuals. The sub-bullet says you have MD, DO, PhD, MPH, MBA, Doctorate of Education, or other terminal degree. If you're not sure, if you say, boy, I have this degree, or is this appropriate, send us an email and just ask us if you're eligible, and we'll be happy to work with you and to help determine if you meet the eligibility requirements. If you are a physician applicant, MD and DO applicants must be in or have completed an ACGME accredited training program. So that's actually really important. So you may be in your program. You don't have to be certified yet by your member board, but we do want you to be sort of on the way to doing that in an ACGME accredited program. Student and trainee visas, unfortunately, are not available. So if we are not able to sponsor visas, so that's just not part of our program. And the other component is if you are a medical student and you're not in a training program yet, we are not able to support medical students in this program. It really is for those who are a little bit further along in their career at this time. Next slide, please. The deadline is June 23rd, 2025. Applications are completed on the ABMS website. You can log in, create your account, and come back to it to add to it as you work through it. The applications include a project description, clear research or project questions, a plan, a budget, expected outcomes, and a timeline. You have to include a statement describing interests and goals for program participation. 2 letters of recommendation, one from your primary mentor and one from the department chair, associate assistant dean, residency program director, or another supervisor. That the chosen mentor is showing the letter that they are there and willing and able and ready to support you in the work. The second letter from a department chair or a supervisor is intended to show that you have the time available to work on this project. And the time is an important component because, as I mentioned earlier, the curriculum includes monthly meetings. There's a lot of work on your project. There's a visit to Chicago that's part of this. And so those 2 letters are really quite important to make sure that you have that time available to work on this. And then a current professional CV to show the work that you've done and the standard way of showing your education and training and the publications and so forth. Next slide, please. So how do we select it? Well, we select it really based on the quality of the proposed research project. As I mentioned earlier, we do look for a nice diversity of types of projects and types of methodology. You might say, I have something I want to apply, I want to submit, but it's really more of quality improvement methodology, not really a researcher. That's great. We love to receive those types of projects as well. You might say, boy, I'm not really looking at hard quantitative data. I have qualitative data. That would be excellent. We encourage you to submit and different types of research methods, but the quality of the proposed project matters a lot. We look for the alignment of the project to the certification research priorities, both of the REF that I reviewed several slides prior, and of the member board. And so if you are applying for a specific member board, a specific specialty, looking at those research priorities, which are available on our website, and making sure that your project aligns with that is important. It is also acceptable and encouraged for you to reach out to your member board before you apply. And that's something we can also help with. Say, boy, I have this great idea in this specialty. I have no idea how to reach out to my member board. Just let us know and we'll help connect you for that. And also the third part of selection is the ability to make substantial progress on the project and contribute to the community during the scholar year. We have received excellent projects in the past, but they are so large, you can just tell it is a 3 or 4 or 5 year project. And we're really looking for projects that are focused and where the majority, if not all of the work, can be completed in the 1 year of the scholar year. Next slide, please. Key dates. So June 23rd is when applications are due. When that happens, after that happens, applications will go out for peer review to faculty who are part of the program, scholars who have either finishing the program or alums who have finished the program in the past. We look through all of those, all of the rankings and all of the qualitative comments, and we will then send out acceptance notifications by the middle of August. The curriculum begins in September of 2025, and that will start with one of those virtual sessions that happen early evenings. They often are on Tuesday evenings at this time, usually about 6 o'clock Eastern, 5 o'clock Central. And then in September of 2026, 1 year later, you're really kind of the capstone research presentation is anticipated at the ABMS Conference. The ABMS Conference has become the showcase, and it's an opportunity to showcase the work of the visiting scholars. And since all of these projects work and relate to physician certification, that conference is really an appropriate place to share the work. Next slide, please. Lots of links in the slides. The slides will be made available to you and sent out for that. And so there's a playlist on the ABMS YouTube channel to hear from recent scholars. There's a visiting scholars page about activities, contributions, research, also gives you the link to applications. So there's a lot of opportunities to learn more about the work that scholars have done on our website. Next slide, please. Okay, and I think we have a couple of visiting scholars who have joined us this evening. Susie, I haven't been able to keep a track of those who have joined in. So I know we had 3 who are planning to join. Do we have?
Yes, correct. So we have Dr. Carr with us, and we have Dr. Winkle with us, and I believe Dr. Oates is planning on joining us. He was coming from a flight. So yep. So thank you, Abby and Reba, for being with us this evening.
Great. I'm here also, Susie. Thanks.
Oh, thanks, Julia. So you were able to make it. Great. Okay.
Oh, awesome. Great. Julia, so we have awesome. 3 of our current scholars. Rima, I'm going to ask you first if you would just say a couple of words about your experience in the program and if you have any sort of words of advice for those who are attending and listening to the information session this evening. Oh, Rima, I'm not able to hear you, and it
Rima,
doesn't.
I think you're on mute.
See if you're on mute. Doesn't. No. You know what? Yeah.
Better now?
Yes. Oh, great. Yes. Perfect. Yeah, go ahead.
Okay, sorry about that. I just wanted to say that the visiting scholars experience has been really valuable for me to work with and get to know people outside of my immediate clinical realm. I always like getting input and perspective from people who are not surgeons and hearing about how things are done and what projects are going on around the country. So it's been a really great time getting to know the rest of my cohort, getting to know the leadership at ABMS, and certainly the opportunity to work on this project and use everyone in the program as a sounding board as I work through it.
Thanks, Rima. Abby, let's go to you next.
See how I did with the unmuting? You good? I'm not a Teams expert. So my name's Abigail Ford Winkle. I'm an OBGYN. I'm the vice chair for education in my department and an obstetrician. And I got involved in this project. I'd heard about some interesting research going on about how clinicians manage decision-making under conditions of uncertainty. And we sort of proposed this assessment, this paper test, to use cases to look at how different OBGYN clinicians make decisions about, do we deliver this patient by vaginal birth or do we do a C-section? And using this model that had been explored with similar gray zone areas, like whether you biopsy a concerning lesion for cancer or whether you consider an EKG a STEMI or pericarditis, and thinking about this as a different way to explore the development of our clinical expertise beyond knowledge and skills. Our board of OBGYN in the part 4 of the maintenance of certification has all of these different kinds of tools that are used to explore your kind of continuing medical education in practice. There's patient safety things that you can do. You can look at look at your past practice habits. And so we sort of proposed this as a pilot. Let's pilot this tool, see, can we determine, is there a variation in how people manage these decisions? Do individuals have bias towards one or the other? And then using qualitative research to then talk to them about what is the value of that information to you? What is it? What is it like to take this kind of test? Are you curious about these results for your own continuing development? Would it be useful in education? So that's the project I'm doing. And I found it really interesting to hear, we often get to be in our silos within our discipline, learning about education and scholarly work, but to have people who are coming from lots of different disciplines in medicine, all exploring different aspects of professional development and training, has been really exciting, because you sort of break down some of the assumptions when you hear someone talk about a similar issue from their different perspective. And we had an in-person meeting last month that was really nice, just a nice chance to dig in deeper with this group of people and build some community. And I was really impressed by how broad the interest of the ABMS is, really in medical training along the whole continuum, and looking at what does it mean, this professional responsibility that we have to be a self-regulating profession. So for me to get to hear from all of the different perspectives on that same shared question has been really eye-opening. And so I find it fun, and I'm very glad I did it. I don't remember if there was another question I was supposed to answer. I just started that.
That was good. That was perfect. And Abby mentioned something that I think mentioned earlier too, is that there is a visit to Chicago for all the scholars that we do, as opportunity to meet with leaders from many of the organizations, self-regulatory organizations that are in Chicago. So ACGME. We didn't get a chance to meet with any from ACCME, but usually they are on the group, as well as AMA and Intel, DCFMG, and so forth. So, Julius, how about you? Just some comments about the program and what you found meaningful about the program.
Sure. Yeah. Thanks so much for having me. So I'm a pediatric ophthalmologist and I'm working with the American Board of Ophthalmology. And I would say that is one of the things that's been great about this program is being able to connect more deeply with my credentialing organization. So I had kind of like a vague sense of what the American Board of Ophthalmology was interested in and their kind of research priorities. And obviously I had experience with them from getting board certified, but it was a really interesting process working with them in developing my application, my research project to make sure that it aligned with the organizational goals and also my professional goals and what was kind of interesting to me. And similar to what Rima and Abigail mentioned, it's been really nice to see how that varies across specialties where there's kind of differences, but also probably more in common than you would expect between a general surgeon, an OBGYN, and a pediatric ophthalmologist. So those would be the two things, a connection across subspecialties and then kind of a deeper connection within my own credentialing organization.
That's great. Thanks all three of you for being with us. We're going to take some questions now. There's a question in the chat that I'll read it for anyone who maybe can't see the chat. It's from Masa says, thank you for the opportunity. Questions to the scholars. What was the key element of your research proposal that helped your application be selected? I'm actually going to field that because the scholars aren't aware why their application was selected. Although they did mention, there are a couple of things that they mentioned in their comments that I think were really very helpful. The first is, and I think it was Abby who mentioned, but I had this chance to work on this pilot project. And so why is that important? Well, a pilot project is actually focused and small enough to really complete most of it during the course of a year. And so that's one thing that we do look at is that your research questions and your methodologies are things that have a reasonable opportunity to be completed in about a year. The second thing that we heard, I think, from all three of the scholars is a connection to their specialty board. So Julius said this really well. I had a chance to work with the American Board of Ophthalmology on the preparation of my application. The boards who are sponsoring want to know what you're thinking about, want to know how you might put it together, and they want to know how they can help. They're sponsoring scholars here because they see this as an opportunity. So aligning your work closely with what the board is looking to do is another way to be successful with the work. And Abby wrote also some things in chat, so there's some answers there as well you can read. We have a question from Anil. Is postdoctoral research fellow eligible to submit an application focused on translational research in transplant surgery? So Anil, I don't know the particular question that you're asking. If your question is mostly about clinical research and transplant, I would say no. We don't really fund clinical research. It's really research about education, about certification, could be about professionalism within a specialty. And so that's actually an important component to think about is if your question is mostly clinical, it might not be a good fit for this program. If you're not sure, send us an email and happy to have a conversation with you either through email or through get on a phone call with you or a video call to discuss your project to see whether it would be a fit. So we can be helpful either way. There's another question here in the chat, and I do see there's a question I think that came up in Q&A, and Susie and Ilya, I'm not able to see the Q&A. And so was one of you able to read that question and then we can answer that?
Sure. Yeah, Greg, one the easy one is that whether the residency director is the mentor we're going to work with, would I need a second reference from another leader within the department? And the other question is, can an IMG, who is not a clinician, ECFMG certified, but is currently an academic and research assistant professor, let me put in the chat, but I answered the first one. I'll put the other one in the chat. That's a long one.
Yeah,
that's okay.
Yeah, Greg, that's a long one. So yeah, I can finish what Ilya was saying regarding the EPSMG in terms of, as you mentioned at the beginning of the talk, ABMS would like to a wide range of applications from, I believe, looking into the applicant's outstanding CVs and proposals would be prioritized.
Yeah. So for the second question, if you're unsure or if for an individual, send us an email after the call. I don't want to spend time here evaluating individuals, and there's probably a lot of very specific questions we would have about whether you could be a candidate. So just send us an email after the call, and we'll get back to you about whether you're eligible or not, because there are some specifics there I think would be hard to do in this call. The question about the mentor be from another institution. They can be from any institution, do not need to be from your home institution. The other question was about whether your program director could be the mentor and would you need another letter. You definitely need 2 letters of recommendation, and if one's from the program director and that states they're your mentor and that you have time to do it, that would be great, but then we would still need a second letter of recommendation. Is a physician on a J1 visa eligible to apply? Yes, as long as the visa is sponsored by someone else, by another institution or by ECFMG. We are not able to sponsor any visas. If you want to ask your question out loud, you can use the hand raise function. If you're not familiar with Teams, in the middle of the menu bar up top is the raise hand. We can have you answer a question. Aaron asked, what are the monthly calls like? I have my perspective from facilitating many of those calls. I'm going to take advantage of our 3 current scholars to describe the calls. And Julius will have you go first. And actually, Haley has joined us. Julius, why don't you go first, and we'll go to Haley to talk about the individual calls.
Sure, sounds good. Yeah, so there are kind of 2 components to the monthly calls. We'll often have a visiting expert from a national organization that will give us their perspective on the kind of priorities of their mission. And then the kind of core of it is kind of a work in progress meeting. So we get updates on each other's projects. Typically, there's 3 scholars that are assigned per meeting that will give a kind of a presentation. It can be an update, it can be an ask for help, it can be a roadblock that they've encountered and seeking advice. So it's really helpful and again, kind of feeds on that interdisciplinary perspective that the program supports.
Yeah, let's go to Haley Silveri, who is also one of our current scholars, has joined. So Haley, go ahead, please.
Hey.
Comments.
Yeah, sorry, I was a little bit late. I'm a pediatric urologist at LSU in New Orleans. I just wanted to add that, I was a little bit concerned about the time commitment because I'm brand new faculty, but I would like to add that I think it's extremely manageable. The calls are once a month, they're virtual, so it's been very manageable to fit into my schedule. I like the fact, so Julius described the calls, but also I'd like to add that the way that it's structured and you present, every so often, it allows space for your project to continue to progress, but also evolve with hearing perspectives from your colleagues and mentors and kind of getting ideas. So, the project that you start with may not be the project that you finish with. And I think in a lot of ways, the projects, become better throughout time. So I just, wanted to add that because I think it's a unique perspective in the way that the program is set up. It allows for kind of this natural evolution in your project.
And Rima or Abby, anything to add about the monthly sessions?
I think that it's a very welcoming group. It's not, it's meant to be works in progress, getting feedback on your progress. Every so often we're graced by a baby or a cat or a dog. It's not like an uptight environment. People are really trying to support the work and support each other. And I've enjoyed getting to know the people in the community.
I think another thing I'll add is the discussion with the other scholars, with their faculty advisors, the questions that come from each person's presentation often, I think, sparks more thought about your own project. And you start thinking in ways that you hadn't considered before. And just like Haley said, your project kind of grows with each monthly check-in. And it's been really educational because I'm a little bit of a novice to doing research and projects like this. So hearing how other people design studies and think about how to answer their research questions is very valuable.
We have another question in the chat. The question is there a limit for the budget in the proposal? Would that be the $15,000? So yeah, the $15,000 is the limit of the budget request. And when you put your proposal together, you need a plan as to how you'll spend that $15,000. It's not a lot, so we recognize that it's not intended to buy any of your clinical time away. It really isn't enough to do that for a physician. It is intended to help you with some travel, help you with some statistical help if you need to buy some time from a statistician. Others have used it to for honoraria for subjects or a small stipend for subjects who may be participating in their study, or to assist with purchasing the license for a survey or an instrument or something like that. So as you put your proposal together, you can think about exactly how you would use the money, and that goes into the part of your proposal, but it needs to be no more than $15,000. We have another question here in the chat from Salim. Says, currently a resident, I'm wondering what typical day or time does the monthly call happen? How long does the call last? We meet in the past, and I think next year will be the same. It's usually on Tuesday evenings, starts at 6 p.m. Eastern, and we try our very best to finish no later than 7:30 Eastern. Sometimes we go 5 minutes later, but usually that's if there's a very robust conversation about a topic. And we meet most months. We don't meet in April because we have this information session. We have a couple of special sessions. We have a session of meeting the editors where we bring some editors from leading journals together for a chance for the scholars to talk to the editors and ask about the publication process and how that works. We have a session with alums of the program for them to come forward and talk about things that they've done and what they've done after being part of the program. We will sometimes have guests from ABMS, so we will hear from the Senior Vice President of Policy and Advocacy at ABMS. And the season always starts in September. We're hearing from Rich Hawkins, the President and CEO of the American Board of Medical Specialties. So we do have some special guests also throughout the year, but largely it is project in progress where the scholars present for about 10 minutes, and then there's 10 to 15 minutes of question and answer. So it is intended to be interactive and to learn and hear about the different projects and how that might help your project as well. A question in the chat from Reinhard. Medical physics residency and board certification are supported by the American Board of Radiology. Would a medical physics resident currently be eligible support proposing testing research method to improve the quality of medical physics residency by supporting a PhD medical physics research program? Yes, that's actually an easy one to answer because the American Board of Radiology has funding for individual in medical physics who would be interested in being part of the program. American Board of Radiology supports up to 4 scholars per year, one in each of their 4 main specialties, which is medical physics, diagnostic radiology, interventional radiology, and radiation oncology. So if you're a radiologist on the call, American Board of Radiology has been very strong in their support for the program. Other questions or comments from anyone? Ilya, are there anything new in the Q&A that I'm not able to see?
No, just the only one I don't think we got to is a physician on a J1 visa eligible to apply. That was the only one I think we did not cover.
Okay. Yeah, I think I might have answered that, and I'll do it again just in case. So you are eligible to apply, but the ABMS and the program is not able to sponsor the visa. So as long as the visa is sponsored either by ECFMG or by your home institution, definitely able to apply. There's a question about whether the recording will be available. We will make the recording available to everyone who registered for the program this evening. We have 57 people on the call currently. I think it peaked at 61, and we had close to 145 who registered. So there was a lot of interest in the program this year, and that's actually more than we've had in past years. So. So question,
May I carry the question? Yep, this is Hong. So I know that J1 is applicable if you're a resident and accredited by ACFMG. That is kind of like rising faculty who's about to get J1 waiver too on H1B or O1.
I don't know offhand, and what I would ask is if you could email the question to us, and so we can give you the right answer. So I don't know enough about the visa programs to know about that transition. So if you email that to us, we'll let you know whether you are eligible.
Sure. And will the funding be like going to the institution or going directly to the mentor? So something like that.
So the funding goes to the institution, and then it goes through your grants program at the institution. That is sometimes institution level, it is sometimes at your department level. And then you must use the funding is then used according to the rules and regulations of your institution as well. So it is grant funding that you access that way. It does not go to it does not go to you individually. It does not go to your mentor.
Thank you. That sounds like that grant can go to buy some time to protect you to do something. As a
it might $15,000 in general doesn't buy a lot of time for a physician in general. But if you have a question about that, again, email a very specific question. Say, well, I want to use money to do this or that. Is it allowed? Email us first before you put together a full proposal so we can let you know whether your proposal for the funding meets the criteria that we have.
Sure. And I'm sorry, you might have already answered this question. I was out for some quick call. But if I'm applying for like something that goes across the board, which I talk about ABM and ABMJJ, do I need to find a faculty who is dual certified, which there's only like 100 people in North America, or I can find 2 mentors, each from the American board?
Yeah, that's a good question. If you're going to be working across boards, I don't think your mentor needs to be board certified in both, but you want to have the support of the boards that you feel you'll be working with. So that's different than the mentor. The mentor needs to be appropriate for the project that you're submitting. But doesn't necessarily have to be board certified in those boards. But those boards have to be supportive of the work, and so that's most important.
Thank you. Would you suggest to do with just one board or just do both boards? Would it be harder to do both boards?
I don't have any specific suggestions about your submission. I would suggest you work on and build the project that is most interesting to you and that you feel would be doable within a year. So
thank you.
We have one other hand up. I'm going to go to a question in the chat, and then we'll come to the hand up. Would the proposed research methods need to be implemented in the 1-year time period, or just the proposal is adequate? It's intended that you are working on it in the 1-year time period. The proposal is completed and submitted by the middle of June, And then if you're selected, you start work in August when you're selected and in September. And it's expected that you would be able to do most, if not all, of the research and all of the work from August of 2025, excuse me, from September of 2025 through August of 2026. So I see a hand up from Aaron. Aaron, please go ahead.
Thank you. I'm wondering if maybe some of your participants can describe the in-person meeting. Is it a conference that happens? Is it always in Chicago? Does everybody who is participating get speaking time on their project, or is it like a poster presentation? And are there special meetings happening during that event for everybody to get together in person?
Yeah, the meeting in Chicago is an opportunity for all of the scholars to come to ABMS offices and to spend time together. And to learn and hear about some special topics. So this past year, we spent 90 minutes talking about professionalism in medicine and healthcare and how that manifests in the different specialties and what it means for the future of the physician workforce. We had a session about developing your skills as a researcher in medical education and what that means going forward. So kind of a professional development session. We made a field trip across the city, a couple of blocks to the AMA. We heard from leaders of CMSS, the Council of Medical Specialty Societies, and from ACGME and Intel or ECFMG. So it's an opportunity to sort of meet. It's not about a poster. It's not about presenting your work. It really is an opportunity for scholars to meet one another and also to get introduced and meet in person leaders from these organizations.
Thank you. It's not a conference, so that it's the continuation of education.
Yeah.
And then I'm wondering, is there, once the projects are done, then does everyone come back and present results to each other?
Yeah, so the results are presented at the ABMS National Conference, which happens in September each year. So the many of the scholars will present either the year when they're finishing or maybe the year after, depending if their project went over a year. But most scholars finish their project in 12 to 18 months, sometimes up to 24 months. So I realized Aaron's question was for the 4 scholars who are here, and I went ahead and answered it. So I gave the overview of it. And does any of the 4 of you want to comment about the meeting in Chicago? We just met last month at the end of March, and so it'd be welcome any comments that or thoughts that the 4 of you had.
Yeah, I'll just echo what you said, Greg. It was a pretty low pressure and collaborative environment. So we really got to bounce ideas off of each other, and it wasn't kind of like a high pressured conference like you might be thinking, Aaron.
I would just add the sort of the cadence of the meetings and the fact of having an in-person meeting and knowing there's a meeting in the fall that you're expected to present at is sort of a good amount of pressure to make sure you actually deliver. You know, you don't want to feel like totally unprepared. So there are little touch points where you feel like, okay, I got to get my act together. And where am I with this project at this moment? But it feels very formative. It doesn't feel like you're coming for judgment at these timeframes. And the specific meeting, it's always hard to travel for meetings, but it's pretty intimate. You know, it's not a huge group, and we're with those leaders. So there were a lot of pretty good conversations. Other projects that I'm working on, I got some really great feedback and ideas about and connections with others. So it's time pretty well spent. I felt sorry for the one person couldn't meet. It had a conflict. And I was like, oh, that person really missed out. But I think it was nice to have everybody there.
So Martin Pusek, who is our director of the Research Education Foundation, has joined. He also put some things in the chat about the ABMS conference, which is in Pittsburgh this year. And And so there's some information there. Thank you, Martin, for providing that. The in-person visit to Chicago is tentatively planned for early December of this year. So something the scholars did ask for is having it earlier in the year would be a little helpful in terms of getting to know your colleagues and sort of getting to know the faculty as well. So we actually worked really hard to try to get that on the calendar and needed to do some changes to the ABMS calendar to make that happen. And I think it will happen. So for any of you who are applying and may be chosen, we'll have you in Chicago for the beautiful month of December in Chicago. We have time. We have just about 4 minutes left. We maybe have time for 1 or 2 more questions if anyone has lingering questions. I don't see any there. If you have questions or anything else come up, please email us. We will get back to you. And if we need a short phone call or video call, we can also do that to make sure we get you the best and most accurate response that we can to your questions. Thanks to Rima and Abigail and Haley and Julius for joining us, and it means so much to have your perspectives and your reflections about the program as well. So thank you all for joining us, and those of you may be listening on the recording. We hope to receive applications from many, many of you, and hope to see many of you also next year in the program. So thank you so much.